Assalamualaikum and hello everyone. Today we will discuss the state pharmacological profile of acute diarrhea. Okay, firstly, the introduction. Diarrhea is defined as an increase in passage of unformed and watery stools in a 24-hour period. It can be categorized into two types, which are acute diarrhea and the chronic diarrhea. Acute diarrhea is the passage of frequent unformed stools, which more than 3 times per day that lasts less than 14 days. It starts onset normally within 72 hours. The common causes are from the dirty waters, dirty hands, bacteria, viruses, and the medication used. The symptoms are abnormal pain, cramps, nausea, fever, and the watery stools. The medication used to treat the acute diarrhea are loperamide, activated charcoal, and the lomitol. Firstly, loperamide. Loperamide is used for short-term diarrhea. It can reduce water in intestine. It also can slow down bowel movement. Secondly, activated charcoal is used as GIT absorbent. It can trap bacteria to prevent from absorbed by the body. Lastly, lomitol. Lomitol is used as add-on treatment. It also can treat the chronic diarrhea.
Hi, my name is Muhammad Izzuddin bin Muhammad ISZHARUDIN, and I'll be speaking on clinical indication of acute antidiarrheal drugs. Clinical indication, by definition, refers to a solid reason for usage of certain medication. First, I'm going to look at loperamide. Loperamide is indicated for acute non-specific diarrhea, especially associated with inflammatory bowel disease. It's also indicated for those who undergo ileostomies. Next is activated charcoal. Activated charcoal is indicated for stomach pain, mainly from gas, uh, diarrhea due to food poisoning or other stomach issues. It's also indicated for those for cases like drug overdose and accidental poisoning due to its absorption properties. Next, it helps reduce itching sensation that felt by those who undergo dialysis treatment.
Hello Dr. Sheila, my name is SYAHIRAH and I will continue for the indication of the Lomotil. Lomotil is a combination between the active ingredients of the diphenoxylate and atropine. It is used to treat the symptom of the chronic and acute diarrhea. So this drug can be prescribed for the patient which is 30 years old of age and above. Okay, so for the clinical manifestation, we can see from the signs and symptoms after 12 hours of exposure, such as watery and frequent loss of the stools that can cause our body to dehydrate due to the prolonged loss of the body fluid. Secondly is abdominal cramp, which is common in patients with the acute diarrhea. Sometimes blood and mucus in the stool can be seen, but must be treated as soon as possible because prolong of this in a long term can cause chronic diarrhea.
Now let's move to the mechanism of action for loperamide. So, how loperamide acts in our body? So basically, loperamide will act by slowing the intestinal motility and also by affecting water and electrolyte movement through the bowel. Hence, loperamide will slow down the peristalsis process and it will also increase the intestinal transit time. So loperamide will also bind to the opiate receptor in the gut wall, which is mu-opiate receptor. Thus, loperamide will also inhibit the release of acetylcholine as well as prostaglandin. Well, basically, loperamide can also bind to camodulin, and loperamide will inhibit the camodulin-ception. Camodulin is actually an important protein which used for regulation of intestinal ion transport, and loperamide also has different distribution within the body than other opiates. And actually, only small concentration of loperamide will reach the central nervous system.
I'm Nur Shuhaida and I will explain about the mechanism of action of activated charcoal. Diarrhea main precursors are drugs and bacterial infection. Consuming activated charcoal will absorb them on its surface particle due to its characteristics, which are large micropore and large surface area. It's able to attract and expel toxins from the GIT, such as helps in cholera management, C. parvum, and also E. coli-induced diarrhea. Activated charcoal also remove excess drug and also targeting the drug metabolites for absorption, such as irinotecan. So how activated charcoal expels systemic drug and poison? It will lower the serum concentration to enhance the non-renal elimination. It will bind to the conjugated drugs before hydrolysis or the conjugated drug before absorption. And the second one is back diffusion. Free drug from systemic circulation across the GIT into the intestinal fluid and binding to the activated charcoal in the gut. The activated charcoal drug complex will be expelled from the gut.
So I will be explaining about the mechanism of action for lomotil, or also known as diphenhydramine atropine. The first component is diphenhydramine, or also known as diphenhydramine hydrochloride. It is an active opiate drug. It acts by slowing the intestinal contraction in the sphincters and peristalsis, therefore allowing the body to maintain the intestinal contents and prolong the transit time. This allows the intestine having enough time to draw the water out of them at a normal or higher rate by increasing the contact of intraluminal contents with the intestinal mucosa, thus able them to stop the formation of loose and liquid stool. The other component is atropine. Atropine gives anticholinergic effect of diarrhea that decrease the secretion in the bowel and slow the peristalsis. It acts by competitively by inhibiting the postganglionic acetylcholine receptor and direct the vagolytic action, which lead to parasympathetic inhibition of the acetylcholine receptor in the small muscle. Therefore, it increases the antimuscarinic side effect such difficulty in micturition, urinary retention, and constipation.
Lomotil is a combination of diphenhydramine and atropine. It is an antidiarrheal class drug, and this drug will slow down the gastrointestinal tract by decreasing the frequency of bowel movements and slows the movement of intestine. Diphenhydramine mainly acts to slow the gut, while atropine is the anticholinergic that helps to dry out body fluid and slow the gut movement, so you don't have to go to the bathroom frequently. And it will directly bind intestinal opioid receptors to the muscarinic receptors, thus inhibit the gastrointestinal motility. And in the market, you can find other brand names like Lofin and Lonox. Like I said before, Lomotil is a combination of two drugs that is used to treat acute or chronic diarrhea. It is safe when you follow the direct recommended dose in short-term use. All drugs must have its own side effect. In Lomotil, it can cause dry mouth, headache, constipation, and drowsiness. However, Lomotil is not recommended to be used in children below than 6 years old because it can cause respiratory and central nervous system depression. Overdose in Lomotil can lead to severe health problems such as convulsions, rapid eye movement, vomiting, and hallucination.
Hi, I'm Sophia. Let's continue with adverse reaction or side effect for each antidiarrheal drug. Drugs are known for its healing effect, but most of them can also cause side effect. The common side effect of loperamide are bloating, constipation, severe abdominal pain, irregular heartbeat, trouble in breathing, nausea and vomiting, as well as loss of appetite. As you can see in the slide, skin rash may also occur. But don't worry, skin rash may go away during treatment as our body adjusted to the loperamide. The other common side effect will be tiredness, drowsiness, and dizziness. That's all from me. I'm going to pass over to Jasni. Thank you.
Okay, next one is activated charcoal. Altogether, there are 7 side effects of activated charcoal. The first one is vomiting, black stool, difficulty in breathing, constipation, nausea, urge to defecate, and lastly, swelling of the tongue. Okay, the next one is the side effect for Lomotil. Altogether, there are 8 side effects of Lomotil. The first one is euphoria, nausea, loss of appetite, dry mouth, abdominal pain, drowsiness, depression, and lastly, numbness of extremities.
Hi, my name is HILMI, and I want to talk about these 3 drugs precaution. Firstly, the precaution of loperamide. So the amplification of system exposure of loperamide can cause the risk of cardiac abnormalities, and then followed by the hepatic dysfunction because it can reduce the first pass metabolism. Next to the allergic reaction, then it has no effect to the pregnancy women, but has high tendency present in the breast milk. Then it also affect the pediatric patient because it can cause dehydration and dysentery. Followed by the precaution of activated charcoal to the allergic reaction patient, then to the pediatric also because it can because their stomach is not well enough nurtured to deal with the chemical predisposition of charcoal. Then to the patient with intestinal obstruction, followed by these stools, slow peristalsis, and unprotected respiratory ways that prior to the installation of charcoal in the lungs. Next is the precaution of Lomotil with a patient with allergies, then pediatric use because it can cause the depression to the central nervous system and respiratory. Then dehydration and electrolyte imbalance patient because it can cause the fluid retention later. And Down syndrome patient, especially the pediatric one, because it can cause the atrophinism. Next, the patient suffer from bacterial infection in stomach, especially Clostridium difficile. And lastly, ulcerative colitis patient because it can cause the toxic megacolon later. And that's all from us. Thank you.